Good afternoon, ladies and gentlemen. My name is Scott Tew, and I'm with Trane Technologies, and it's a pleasure to be here today in Belém at COP30 to discuss what I believe is a really critical issue facing the world right now. And we're feeling it today in person here in Belém, and that's extreme heat. And this quick conversation with my two guests is focused on extreme heat and solutions that include efficiency and innovation. And we have two incredible panelists here with me today to talk about this from two different viewpoints. We have Dr. Ashita from India, who's going to talk about health-related issues related to extreme heat, and Max Mueller from Bayer, a health company that will have a different view, but a very important view on how we move forward related to this issue. I think that extreme heat, especially as we think about the built environment, we spend 92% of our time indoors. And we do that because outdoors we have significant heat-related issues. Extreme heat events are on the rise globally. They are there's not only more of those, but they're also lasting longer, so the duration is much longer than in the past. Extreme heat events used to be once every several years, and they were short-lived events. Today we live in a world where extreme heat events and the implications of those, including wildfires, flooding, and other natural environment related issues, is on the rise. And I think this presents not only a serious issue for human health and for community management, it's also a big opportunity. It's a big opportunity for our communities to understand how we can become more resilient. For the built environment, which I represent, it provides a new moment for us to rethink building design, to rethink cooling technologies and innovations related to human health cooling. And then I think on the other side of all this would be, how do we ensure that we continue to be a productive society in the face of these extreme heat events? And so that's the conversation today that we'll have with my two guests, and I'm delighted to have them both with me. I'm going to ask them now to introduce themselves, give a bit of background of their interest on extreme heat, and then we'll go into a Q&A period, and then we'll have some time at the end for questions from the audience. So with that, welcome.
Thank you so much, Scott, for having me here today. Hi, everybody. I'm Dr. Harshita Umesh. I was a previous youth policy champion for UNICEF on SRHR, which is sexual and reproductive health rights, and I'm currently a UN Women Young Feminist leader. I work in the spaces of gender, climate, and health, but I'm a frontline worker and a medical professional by profession, and I'll be starting my general surgery residency soon. My interest with extreme heat comes from the fact that I live in India and it's always hot. I mean, I'm living in the tropics, aren't I? But also as a frontline worker, we see communities come into the hospital every single day from all these heat-related illnesses. And a lot of this is preventable, right? Like, why are we not doing something about it? I think it's extremely important for healthcare providers to be at conversations like this, to understand perspectives, but also to share what the human face of all of this is. Because we are people who see the human cost and the toll every single day. Thank you.
Thank you.
Thank you, Scott. My name is Max Mueller, and I'm the Global Head of Public Affairs for Bayer. And I'm delighted to be here. I'm German, but I'm also Brazilian. So while used to the heat, it is obviously a bit of challenge here in the tropical rainforest, so I can fully understand. I just have been in India 2 weeks ago, and I can confirm it is hot there. We're working in the sector of healthcare as well as agriculture. And so tackling these topics has a twofold aspects for us. We have our customers who work outside, farmers and their families who are impacted by extreme weather disasters, and also the consequences coming out of that. So that's one thing. Then we are also a company that produces around the globe, including in countries where extreme weather and heat is becoming more and more of an issue. So there's on the one hand part, how can we adapt for our own labor force, but also for our customers? And on the second part, and it's grateful to have someone sitting next to me who can correct me and add to that point, maybe we see more and more critical diseases, not only the NDCs, but also We see cardiovascular diseases, kidney diseases on the rise as a consequence out of extreme weather incidents. So, yeah, there is a common objective, and thanks for having us to talk a little bit about what we can do.
Thank you very much for the opening comments. Let's just start with a question, Dr. Harshita. Could you talk about groups that are most vulnerable? Obviously, you spend a lot of time with a variety of patients in India, and I'm thinking many times about workers. However, you have a very different perspective. So can you talk a bit about which groups you would say are most vulnerable to extreme heat events?
Okay, maybe let's disaggregate this by a lot of data. So I'm going to be throwing a bunch of data at you right now. Let's start with children and youth, because I'm youth myself. Children and youth, especially babies, they don't have the capacity to regulate their body temperature very well. So when extreme weather events happen, it's extremely difficult for them to regulate their body temperature, and you see that there's hyperthermia or hypothermia that happens. And that is extremely challenging because their kidneys also aren't well adapted yet, and that results in a lot of deaths that happen. So the neonatal mortality rates start increasing. And in low resource settings, especially not just in India, but all LMICs, LDCs, we don't have a lot of technologies in healthcare infrastructure to ensure that there's constant cooling that's around. And even when there is constant cooling around, it's not always cool enough, because I've seen in my own hospital, for one incubator, we would have had 3 babies put together. Or if the baby ends up with jaundice because they're so dehydrated, the mother's not able to breastfeed the child enough. And that's another vulnerable population, pregnant people. Because pregnant people are feeding 2 people, right? They're feeding themselves and the fetus that's growing inside of them. That means they require twice as much as nutrition, twice as much as hydration, and they're also not supposed to be working. But in a low and middle income country such as ourselves, a lot of unpaid care and labor is done by women. And the women are often the last to eat, which means their nutritional value that they're getting is automatically lesser. And that already puts a strain on their kidney and their livers again. But if we flip that script a little more and go to the other age extreme, which is like elderly people, yeah, their bodies are already, their bodies are already going through atrophy. It's no longer functioning as well as before. So they're not going to be able to tolerate that heat. But people with existing health conditions as well, right? Somebody who has hypertension, as my colleague was saying, cardiovascular diseases, kidney diseases, those who are on dialysis already, those who are taking medicines for that. When you have hypertension, the first line medicine that we treat them with are diuretics. Diuretics essentially mean that they're reducing the amount of water content that's in your body, right? Because you're filtering it out through your kidneys. And now you add in the heat aspect of it. Come on, we're all sweating here. We're in Belém. How many times have we used the restroom? Now imagine if you're hypertensive and you're taking a medicine for that. It's going to be that much more harder for us. But healthcare workers also aren't very well accustomed to how these pharmaceutical industries and these pharmaceutical drugs are adapted to this heat. And we often end up using the same doses that we're doing. And that also causes an issue on the other side. So to answer your question, I think there's a variety of people disagree by age, even the labor workforce. I know a lot of informal workers, for example, those who are doing waste picking on the roads, those who are on the street, construction workers who don't have access to any kind of cooling, who come in with heat-related illnesses, and people say, oh, it's a heat stroke, oh, but they're not acclimatized. But they don't have a choice but to stay in that heat, because if they don't work that day, they don't have a roof above their head, they don't have food, and they don't have water. And there's not much that the government can do to subsidize that. So I feel when we talk about this as a healthcare worker, because we also are on the front lines oftentimes, I was just telling you a couple of minutes ago, so we have this Pulse Polio campaign that we do in India, and it's sometime around February, so it's a slightly cooler time. But we also have like our national immunization campaign, and we go door to door to find out how many children are in each household to ensure that they're vaccinated. And that time it's just us carrying a small bag with all the vaccines inside. But we're not sure if that vaccine's going to last, and we're going to look at the cover every single time. But that causes contamination, and that could also lead to diseases. And that also increases their vulnerability. I feel that this is very multifaceted, and I will continue to keep talking if I keep talking. So I'll let you move on to your next question.
No, thank you. I think you did a great job identifying many vulnerable populations. And you couple that with with what we're seeing on the ground even today. So, what about your ideas on, should we be focused on new policies? I mean, you mentioned behaviors that probably need to change, but are there policies around this that we should also consider?
In theory and in paper, I've read a lot of policy papers, and I think that we've done really great on that. Everybody is talking about the increase in extreme weather events, but there's a real gap in implementation, mainly because we're all so overwhelmed and we're all using it, we're all hand to mouth at this point. But I guess if I would talk about policy, the first thing that I would say, and I say this every single time that I'm at the panel, I want us to ask ourselves, who is at this room right now? There are a lot of people who are at this room, and we're privileged to be in this room because this room has air conditioning. I know it's not great, but if you've been to the Children Youth Pavilion, I was just telling my colleague about this. Right opposite to us is the IRENA Pavilion and the Global Renewables Hub, and we had a negotiator from Papua New Guinea who came, who spoke for a couple of minutes and then fainted and had to be taken away. I was just like, we're at COP, we're talking about these policies, but we're seeing how it's not really happening in our days. I think when we talk about this, it has to be mandated and in law enforcement that we have to have acclimatization to our workforce. So somebody who's not acclimatized to a particular temperature. So 40% on day 1, 50% on day 2, 60% on day 3, 80% on day 4, and give them the enough breaks and times that is needed to hydrate, but not just drink water, because when you sweat, you also lose electrolytes. So to also ensure that you're ensuring that they have access to those electrolytes. Also talking about infrastructure, because that contributes to this, and urban heat islands, because I was also telling him how my city, which is Bangalore, is known as the Garden City of India, and was filled with lakes, and the mean ambient temperature throughout the year was 18 to 25. Can you imagine that? 18 to 25 throughout the year, what a lovely place to be at. But now we have skyscrapers that are going there. But there's no control and regulation on what building materials we're using, what infrastructure we're building, and the deforestation that's rapidly happening. No, it's not enough for me to just say, oh, I planted 5 trees because I felled this one tree, because that tree had a lot more leaves, a lot more capacity to actually cool the places down. So I would say that that's the first thing, that these policies are not just towards one particular item, but towards multiple things. Like even in healthcare systems, our healthcare systems take a lot of energy ourselves. Like our ICUs always have to be in the cold temperatures, our operating theaters always have to be cool. But there's another way to ventilate it to ensure that we're not wasting energy over there. And I think we need a lot more policies talking about renewable energies and energy energy security, so that we're not wasting our energy. The second thing is, I think we need to have a lot more labor rights protection for all sorts of people. We also need to identify vulnerabilities and have specific policies on those vulnerabilities. There needs to be climate risk insurance for these vulnerabilities. And the best example of that was something that happened at SEVA. So a couple of years ago, India had one of the worst heat waves. And SEVA is an informal women's alliance of self-employed women. And they actually asked these women every day to give a little % of their income. But when the temperature was above 40 degrees Celsius, they told none of them to work, and they paid them that day's salary. Now, in the short term, that was a huge payout that came out. But in the long term, it increased the person's economic growth and ability to actually work, and they made a lot more money. But not a lot of climate insurance companies are doing this. And I feel like that's another aspect. If people knew that they had the security for it, that would also be better. Apart from that, I would say that we need to have local knowledge being integrated into this, because we have like local foods that you can eat to automatically cool your body system down, but it has to be interpreted in local languages so it reaches the last mile populations, because those are the ones that are most affected.
Very good, thank you. That was very surprising in some ways. It was also very good in terms of the policies needed. The policies are there. I think you pointed out the fact that even though the policies are there, we still don't have what we need in terms of infrastructure and behaviors to back up the policy. So great points. Max, I want to turn to you now and ask about the Bear's specific work around and policies around worker safety and related to extreme heat events.
Yeah, thank you. And we just met, and I just told that I'm going to be in Bangalore in March, and she gave me so much food for thought, and also, if I may say, just a couple of points on what we are doing actually to tackling the issues that she's meant, and then I will go directly also to your question. The increase of extreme heat for children and women has risen 4 times in the last 20 years. We're now up to 20 days, which doesn't sound a lot, but you just heard what it makes to the human bodies. We in Bayer, we're trying to tackle exactly this with our access to micronutrition, in particular during those early days when infants and also the mothers are so heavily in need for that. So that's one of the many things of what we do, and it's part of our sustainability commitments. And it's in particular in those countries and areas, I don't like that terminology a lot, global south, but to some extent it is this where we are headed. We just had on Monday an event on exactly the workforce in the hospitals or the health workers' needs, how they tackle this with their need. And I come to 2 examples and to your question. So we just built a factory for seeds in Zambia, in the city of Kabwe. Kabwe is an old mining region which is now turning more into the sector of agriculture. And this seed facility is going to serve, or starts from the serve, more than 6.5 smallholder farmers. Which provides also opportunities, and most of the times the women are the caretakers of the whole family, in particular the outdoor work. So when we built that plant, we asked ourselves, what about healthcare in this region? The next health spot is 24 kilometers away. Now, if you live in an urban area like me in Berlin, 24 kilometers, public transport, no problem. Maybe a bit annoying, but it works. In Kabwe, it's like a day's walk. So what we did is we aligned with the local community and said, okay, what is your concrete issue? How can we help? And I said, we can manifest health workers, nurses and doctors, but we don't have the money to actually build a health spot. So what we did is we teamed up with the government, with a local NGO, and we are building this health spot, which is going to be opened in Q1 next year, so after a year building time, which is not only going to serve the people working there, but also 15,000 people in that village. Now, one of the things that these nurses who are going to be trained are going to teach them is to say, you're working outdoors. So please, every 2 hours, go out of the heat, cool down for 30 minutes, drink some water, and in this health spot, and it is at least something that we learned through that discussions, which is why it's so great to be here at COP, after every 6 to 12 months, let's do kidney examines. Today with digital technology, that is so much significantly easier to be done. With these comparably small measures, you can achieve quite so much and really do this. And how did we learn about that? We have a factory in Costa Rica. So Costa Rica has no lack of water, thankfully for them, but it's also extremely hot. Lovely, but hot. That being said, we have seed workers there, mainly for cotton. And we're doing exactly that. So we are doing all these measures I just described in Africa. Every 2 hours come in. We take the temperature. So we are making sure that they not only drink, but also there we have everywhere around that in a rather easy language and with a lot of haptic elements, the explanation what it happens to that. Now, next to that, we just opened last Thursday a site in Albajuela in Costa Rica that is a part of our family planning part. So long-term contraceptives, for instance. And one of the things that is that we not only offer them good work in a new facility that is carbon neutral, that is working with mainly renewable energy. And the good thing in Costa Rica, 96% of the energy is renewable anyways, but we can do that there. But so for them, it's also the decision if, when, and how they're actually getting pregnant, This is what we do all over the globe with our other sustainability commitment. But it is also, we train those women, explain this, try to get them jobs. If it's not in our factory, in the business parks around that, but continue this with these explanations. And I cannot agree more. Our problem is not policies and regulations. There is plenty of that. And I applaud the COP30 presidency to call this the COP of actions, because it is about the implementation and the money. And the private sector has to do its part, and I think we are willing, for our house, that's for sure. And it is also, and I want to close here with this example, giving the mic back. If competitiveness comes along with that, it helps. Seeing that renewable energy make a new plant even more competitive, because cost efficiency in the end is going to also increase, let's call it what it is, the profitability of a company, is the sort of incentive that we need rather than more bureaucracy and regulation. But it is the examples, the proof of concept that it works, and the public support from young leaders such as to my right, who are really supporting these efforts and make us better. And then I strongly believe we are going to find good ways of adapting to the issue, not forgetting the mitigation part where we are more in the adaptation.
So Max, is there a business case currently for doing some of these things?
Oh yes, absolutely. I mean, we are in the city of Qidong in China, we are building the first 100% carbon neutral plant for Bayer for consumer health, which is also part where we produce micronutrients. So that's one of the examples. And we wouldn't do that not only because of the Chinese green energy program, but it is cost efficient, right? It is in a circular economy way, better we use less plastics, we use more renewable packaging where it has happened now. We just heard about the example on vaccines, so there is a certain level of where we need to protect also the product, but it works. The second example is in Spain. We have a very, very old site. Historically, it's called La Figuera, and it's in the north part of Spain, also an old mining region. And this old plant that was carbon emitting in a region like crazy has now been rebuilt carbon neutral, because we have, for instance, a PPA agreement with a large energy provider in Spain, and they said, look, you give us a guarantee for 20 years that you're going to offtake our renewable energy, then we are willing to invest. And we did that. They were willing to invest, and we see the costs are getting lower. And so that is our part also to participate. And our employees, they see with their own eyes and in their, that climate protection, investments in really tackling those events is not something that endangers their jobs, but it is the opposite. It makes them more competitive. It's not only in the south where we have a lot of photovoltaic energy, or in Bahia where you have wind energy, but it is a recipe to make us more competitive and yet profitable. And I could also cite examples in the United States, also with regard to renewable energy. So there are the examples there. Unfortunately, if I may say this, we are not talking enough about our successes. We are talking more about the failures. You hear people complain about the Paris Accord and say, oh, we missed the 1.5 degree target. True, and we feel the heat. But just imagine for a second, if we would not have achieved that in Paris, we would not talk about 2% now, we would talk about 4%. 4 degrees Celsius, not 4%, sorry. 4 degrees Celsius, you know what I mean. So let's talk about more what's working and not always complain.
Yeah, thank you for that. We've covered a lot of territory. Our time is almost up. I wanted to mention one thing. Earlier this week, Trane Technologies, in partnership with Forum for the Future out of London, released a new white paper called Extreme Heat Readiness. It's focused on what's required in collaboration to solve what I believe is the invisible great crisis that we're facing now as a population, as a world population. Thankfully, my panelists did a great job of talking about vulnerable populations, but beyond the vulnerable, it's all of us that hold a piece of the solution. It's policymakers, it's the private sector, It's also government agencies, and it is all of those subnationals who have great ideas on how to make us more resilient. It's called Extreme Heat Readiness. You can Google it, you can go to the Forum for the Future, you can find it on LinkedIn right now. It's out there, and it lists 6 major pillars of progress in 6 different areas. It also highlights, along with a lot of great facts, it also highlights the work that's still needed. And I think you'll find it to be very helpful as you think through extreme heat readiness and as you also think through the issues of extreme heat. Since we have about 2 minutes left, any questions from the audience? Today's event is being live streamed as well, so there is a global audience listening in, and it'll be available later as well. Any questions? I have a question here. You're going to need a microphone.
Thank you. Hello, I'm Meg Calkins with the American Society of Landscape Architects. This extreme heat is on our radar, and I just want to point out that there's a lot that we can do in the built environment to mitigate extreme heat. And we have a climate and biodiversity action plan that we just came out with. We're one of the few professions that can address both climate and biodiversity issues. And we do address urban heat islands and strategies for reducing them in our publication. My question really is to you, Scott, the moderator. That white paper that you mentioned, to what extent does it address built landscapes and urban context?
Yes, there is obviously a big focus in the white paper of urban centers, and urban heat islands is certainly part of the discussion. For those who aren't aware, urban heat islands, we typically see a roughly 7-degree F increase in urban centers related to the built environment and the way things were designed, and a lack, obviously, of cover. And there are solutions in there. The good news about the white paper, this is just step 1. It was created through workshops over the past year with a variety of organizations and interest, expertise, academics, NGOs, government agencies, small cities, small organizations, and very large private sector as well, all together on solutions related to extreme heat. I think we would love to have your voice as we continue this discussion, so thank you for that. I think we are at time, and let me stop here by first thanking, if you would, help me thank our panelists, Dr. Harshita and Max. Thank you very much. Thank you all for joining us today for an extremely important topic. I hope it's not the last time that you're at an event where we're discussing how to be ready for extreme heat. We all have a part in the solution. Thank you for your attention and for being here today. Take care.